The province is encouraging Albertans to check their vaccine status and ensure children are up to date on immunizations as cases of whooping cough begin to rise. 39 cases of the virus have been reported in the Calgary area as part of a recent spike just south of the city. Here's Mark Villani.
It's a highly contagious illness, one that infects the airways and lungs of young children. Whooping cough can last for upwards of 100 days. It's bacteria living on dry objects for up to a week and symptoms lingering sometimes for more than 3 months.
It starts like a typical kind of viral illness with the cough and runny nose, but the cough is very characteristic because you have this kind of series of coughing that prevents you from actually taking a breath.
But the cough can also lead to seizures, brain injuries, and sadly, death.
About 10 days after her birth, Harper started coughing. We all thought it was a cold.
Harper Whitehead passed away from whooping cough at just 1 month old in June of 2012. Her family then hoping her story would be a warning. But fast forward and cases aren't going away. The province is reporting 17 whooping cough cases in Okotoks since November, all of them locally acquired.
We get called all the time asking about it, yes.
Pharmacists in the area like Robert Raphael say demand for whooping cough vaccines is increasing amid the outbreaks.
The vaccine gives protection, especially in small children and pregnant women because they pass it on to their babies, especially during the first year.
And despite children being the most vulnerable, just over 70% of 2-year-olds are up to date on their pertussis shots. That's taken a dip since 2008, while other regions like the South Zone see less than 60% of kids immunized. Health experts say those low vaccine rates in rural areas are why we've been seeing larger case numbers there, nearly 1,000 since November of 2022, and coming off what was the second worst year in a decade.
We need to, ensure people understand that these remain serious illnesses and that we have to get those vaccine numbers up if we want to get back to our levels of herd immunity.
And Mark joins us from near Foothills Hospital tonight. Mark, Alberta Health Services says a lack of vaccinations is linked to these higher case numbers.
Yeah, that's right, Tara. About 86% of outbreak and non-outbreak cases of the whooping cough in Alberta are linked to people that are either not immunized or only partially immunized. It's why the province is encouraging everyone to stay up to date with these shots and booster shots as well. Now, the pertussis vaccine is free of charge for all children under the age of 18, people that are pregnant in their 3rd trimester, or for adults who haven't had a tetanus booster for at least 10 years. Alberta Health again saying you can do your part too to prevent this illness by practicing good personal hygiene, making sure you wash your hand, and avoid doing things like sharing cutlery, food, or drinks if you're feeling sick. Tara.
Good advice. Okay, Mark, thank you.